So I'm a little nervous. And where's my therapist when I need her? So hold on just a sec. Okay, that's better. Thanks. All right. So almost exactly 6 years ago, on a hot sunny day, a young man was late for work at the local burger joint, and without checking before he made his left-hand turn, shattered my left leg with his shiny red sports car. I don't have any difficulty remembering the events of that day or the thoughts I had or even that boy's name, and I'm usually really bad at names. But that's because it was traumatic. Thankfully, most healthcare-related events are not so miserably memorable. When a person goes to the doctor for an acute problem, they're generally pretty good about reporting their symptoms, but acute problems often overshadow more important concerns. And if you're in the doctor and if you're with your doctor and you have an earache, that's where your focus is going to be. But if your doctor is asking you about something that really isn't bothering you at the moment or has a long and complicated history, you're not going to be so accurate in reporting your symptoms. So that's really true with therapy clients. They have their symptoms outside the office. They live their lives outside the office. I'm not with them when they have their symptoms. If I'm seeing somebody who has a fear of snakes, I'm not pulling a snake out of my drawer. My drawer is not big enough to hold all my clients' fears, and I'm not going to be with them when they step on a snake in their backyard. So if I have a patient that comes in, they're also going to be focused on the things of the day, whatever it is that happened, the acute crises that happened at home. They may not actually remember what it was that triggered their panic attack 2 weeks ago. So what is a trigger? A trigger is an important concept in cognitive therapy. It's where clients learn that their symptoms can be triggered by something as small and fleeting as a thought, something that is so easily overlooked that they don't even notice it or remember it. So say a man comes in and tells me he's very angry with his wife and they had a big fight. And I'll ask him, well, what made you get so mad? What caused your anger? And he might say, well, she was late again. Totally forgetting the fact the actual trigger was the thought that her tardiness was just proof positive that she was completely uncaring about his feelings. So think back, pretend you're back in middle school, God forbid, and you're going down the hall in the 7th grade, and your best friend passes you without acknowledging your greeting. So that could be a triggering event. Not being responded to is certainly a triggering event, especially in middle school. But the power of that trigger is going to depend on your thought, what the meaning is that you give that incident. And what thought you give it is going to have a different feeling associated with it. For instance, you could be thinking, well, my friend just didn't see me, so you're going to be relatively unconcerned. You could be wondering why your friend was so preoccupied, so then you may be worried. You could be fearful that somehow you've hurt your friend's feelings, or you could be furious at the perceived snub. You could also be thinking something along the lines like, see there, I got no friends. I hate the school. I'm a loser. And that thought can stick with you all day, and it certainly can affect how you deal with your friend when you see them after school. So, therapists are always trying to get people to write these things down. I've been a psychologist for over 30 years, and I try to get people to write these things down for years, and they typically don't do it. They're terrible at it. So what is it, that I forgot my pen, I didn't have a pen, I forgot, I was tired, I was going to do it later, I didn't fill out the paper, I lost the paper, I filled it out, but I left it at my house. So not only did they not do that, but they also didn't use the strategies that they were going to use to manage their symptoms because they were in crisis. They didn't remember to pay attention to the triggers so that when they come in for the appointment, they can't really remember what the triggers were. But everyone now has their cell phones. And so what this did was it prompted me, this is what prompted me. I went to a convention, and it was a program on anger management. And I thought it was a fantastic program, except that the participants, mostly young men, were supposed to be having a paper and pencil with them, and they were going to write down their triggers and their strategies and what they thought, and have that all written down and bring it in for their next session. So I was thinking to myself, how many of these guys are going to do that? And I already know the answer, not very many, but they do all have their smartphones, and they're using them all the time. In fact, someone told me the other day that the average person looks at their smartphone or their cell phone 150 times a day. So I realized the smartphone, we all have one, just about, could be a powerful therapeutic tool, and it could radically improve the effectiveness of therapy. So what I did was I wrote some content and launched a website, and I've been using it with my own clients for about the past year. It's called symptomreporting.com. And with symptom reporting, my clients are able to cue themselves on their coping strategies when they need to. They can track and transmit their progress to me in real time, so that when they come in for the appointments, we have a lot more time for focused problem solving and treatment adjustment. What they've also discovered is just the very act of using symptom reporting has been an intervention, because it causes them to think about their symptoms in a different way. Typically, I'll sit down with them and we'll figure out of the 30-plus tools that are currently available which ones they're going to use. I send them a link so that they can use it on their cell phone. And if they don't have a smartphone yet, they can use their computer or their iTouch or their tablet or whatever if they need to. But we figure out when they're going to use it, and then before they come in to see me, I'm able to access the secure site and see how they did. I can see what symptoms they had, how severe were their symptoms. I can see whether they used the strategies or not, or how effective those strategies were. And sometimes what I've discovered, I'm just going to skip one ahead. Sometimes what I've discovered is that I look on the site before a patient comes in, and I discover some really important information that I would have had no way of knowing otherwise, like here it shows, you can't really tell, but it's a suicidal mood swing. The other thing that I've been able to use the site for is monitoring response to psychiatric medications. I work with a lot of families, and parents are often quite worried about starting their child on a medicine, whether it's for ADHD, which is the most common, or for some other issues. And they feel a lot better if they're able to have a way to monitor how their child is doing on the medication, both at home and at school. I've also discovered that, at least down the road, that symptom reporting can have huge applications to pretty much any area that there's a collaboration between a client and a provider, whether it's life coaching, in-home elder care, PTSD with veterans, getting better after surgery, many different areas. And that's where I intend to go in the future. So basically, in summary, what symptom reporting has done is it's allowed treatment to be increasingly efficient, patient-centered, and evidence-based. That's going to be especially helpful in the future when our reimbursement models switch from fee-for-service to fee-for-performance. It also helps me collect data that otherwise would have been lost or distorted. It maintains contact with my patients when they're living their lives outside my office. And it's always in, even when the doctor is out. Thank you very much for your time.